bottom of our hearts to the providers in the community, to the community organizations in the community, to the volunteer organizations and the faith community that is standing up during this critical time to continue to serve the vulnerable populations who have critical needs and are going to continue to have critical needs in the days ahead. Thank you.
Thank you, Carol. And cannot thank you enough for your leadership on this and across the board. A couple of very quick items. I'm looking at Nikita. We're going to have something to say on elections tomorrow, so I could maybe save you or David's question on that front. I meant to say that up front. Secondly, we don't have any announcements today in terms of further social distancing steps, such as we did yesterday with indoor malls, but just know that we're continuing to look and monitor what we've got in front of us. For instance, Pat and a lot of his colleagues were out last night trying to sort of spot check the state, and we still feel there are a couple of holes in the system, so we're looking at that. And thirdly, while there's no particular action associated with this, as I sit here, we are in tense discussions, not just with the federal government, with the White House. I had a good conversation with the Vice President yesterday afternoon. I mentioned we sent a letter in late yesterday afternoon regarding the Army Corps, and Dan got a response last night, and we were on the phone this morning, so that's a good thing. Other areas, I have no news to report on PPE, personal protective equipment, but that's something which is still a significant ask that we have. But in addition to our relationship with the federal government and the congressional delegation, cannot say enough good things about them on both sides of the aisle, just their passion, intensity. What do you need for us to do? Some of the best fighters in the country in Congress happen to represent New Jersey. That's a good thing at a time like this. But also to say that we are in constant discussion with a group of other states as well. And I'd say high on that list are New York, Pennsylvania, and Connecticut. They're not the only ones, but we are constantly thinking through where our commonalities are, and there are many. And if we can combine forces and ask for X or Y, we will be stronger in that ask if we can do it together. I don't want to cut anyone off, but before we take questions, Pat, Ed, Chris, anything any of you want to add? Okay, please feel free to jump in on any of the questions before us. You good, Judy? Okay, let's take a few questions, please. Brett?
Real quick, three things. One, hotels, they still okay to operate as they are? Two, what area of the state, what county has the most need for hospital beds? And three, the second testing site in Homedale, do we know when that will be online?
First, hotels are still open for business, Pat, to the best of my knowledge. Although Pat's an important guy, because based on the executive order that Sheila and I put forward, it gives Pat complete latitude to add or delete entities from that list. So as we're walking down here, hotels are still okay. I'll let Judy answer both the second and third question, but I would just say Homedale, we hope a matter of days within Bergen opening on Friday. Judy.
In the Northeast, yeah, it's going to follow, it's just going to follow the spread of the disease. But we do anticipate that it's going to be a statewide issue before long.
That Homedale is, or Pat or Judy, within a matter of days after Bergen opens. Chris?
We're working to have the Monmouth County site up and running.
Looking at each other to make sure we agree with our answer. May I just say, I don't know if Judy said total cases. You said how many overnight, but total cases to date by county, top four, Bergen 113. This is the denominator, is 427. Secondly is Essex at 45. I know, for instance, Essex, Congressman Payne, the county executive, they would like to try to figure a way to work with Pat and FEMA and Department of Health to get a drive-through. That's going to be a little bit more off. Middlesex has 40 cases, and my home county of Monmouth have 32. Those are the top four. Please.
This is a question for Commissioner Judy on testing.
To say Alex has got the mic again with the off-white ivory-colored glove, and the reason for that is for our streaming services. It doesn't do anything for amplification in this room. Forgive me for not saying that already. Please.
So, how many different kinds of COVID-19 tests are being used? Do we know? It seems like different medical groups and organizations are adding them almost every day now. You've got the FEMA coming in with their tests. You've got another drive-through test in Secaucus. Somebody else is opening one. Is anybody keeping track of this? Do they have to get FDA approval? Do we know, are there problems in terms of reliability for these tests, false negatives or positives? Could this skew our overall picture of what's going on here? And are there any suggestions for people in terms of where they should or should not go to get tested?
Let's let Judy answer, and or Chris. Chris, do you want to jump in?
So thank you for those questions. I think the point of clarification is that these sites are specimen collection sites. These are locations where individuals who are symptomatic can present, go through the process, have a nasal swab specimen collected, and then those specimens at the end of that operation are brought to one of the commercial laboratories for processing. So the process for specimen collection is basically standardized throughout the state, and then depending on where the clinic is operating, they'll send their specimens to a particular lab like Quest, LabCorp, BioReference. The test, the same tests.
That's what he's referring to. It's collection on the front end, of which there are a number of different places you can go. The most robust as of Friday will be the one, I think, in Bergen County College. But the back end, there's a limited number of folks who actually perform the test. There's the Department of Health, there are a couple of hospital systems, and there are